Hi, everybody. This is Dr. Brett from Performance Chiropractic in Olathe, Kansas, and I just wanted to present this presentation. Actually, about a year ago, I was a member of a group of other entrepreneurs and business owners in the area, and they asked me to present a presentation on 10 of the common chiropractic myths. And so I wanted to share this with you to give you some more information, and hopefully you might get something out of this. If you're looking at scheduling an appointment with Performance Chiropractic, maybe this will help to dispel some of those myths that surround chiropractic in general. So I thought we would just go into this. So when we talk about chiropractic, there's a lot of myths that people they really don't understand when it comes to chiropractic and how chiropractic can help them. A lot of people don't realize that chiropractic actually won a very large lawsuit against the American Medical Association back in the 1980s. This was a case called Wilkes versus the AMA, and what they actually found is at that time, the American Medical Association had actually put out a message to all the medical doctors at that time. They got this memo that came across their desk that basically said, do everything you can to dispel and discredit chiropractic. And it was basically an antitrust lawsuit, and the AMA lost that lawsuit. The good thing is that today the medical profession realizes, and science in general realizes, that a lot of the things that we've been saying in the chiropractic profession since the 1800s, the late 1800s when chiropractic was founded, that we've been telling the truth. We've been talking about the nervous system and how it affects our health, and the musculoskeletal system and how it affects our day-to-day comfort and ability to be able to live without pain. And so many people don't realize this, and the cool thing is that I know me personally, I have a great relationship with a lot of medical doctors. We get lots of referrals in our office, and if these myths were true, that simply wouldn't happen. So let's get into it. We called this For the Record, and it's dispelling 10 of the common chiropractic myths. So the first myth is that chiropractic care is expensive. There was actually a study published in 2010 in the JMPT, which is the Journal of Manipulative and Physiological Therapeutics. This is a peer-reviewed journal, showed that care for back pain, when initiated by a doctor of chiropractic, was 20% less expensive than the same treatment initiated by an MD. Not only that, cases were actually more likely to not end up in spinal surgery. And this is only one study. There's actually several other studies. There was one done in the late 90s, early 2000s called the RAND study, and that actually showed that there was a huge difference in costs and efficacy or effectiveness of treatment between chiropractors and medical doctors. The second myth is that chiropractic care is dangerous. Chiropractic is incorrectly believed to be more dangerous than standard medical interventions that actually increase the risk of re-injury. Surgery and medical side effects are much more dangerous than conservative, non-invasive chiropractic care. So when somebody has low back pain, let's use that as an example, when those patients actually go through medical intervention and they're just given drugs for that pain, or heaven forbid they should lead towards surgery, that the chances of re-injury are much higher because they've never done anything to affect the structural integrity of the low back, and that actually can be more dangerous to the patient than being treated by a chiropractor. The third myth is that it's unsafe for children to get chiropractic care. The truth is that research has shown that it's not only safe, but it's actually recommended for children as young as babies to see chiropractors. Being as active as they are, children are susceptible to injuries that affect the functionality of their neck and their back, and chiropractors adjust their techniques to make sure that adjusting children is as gentle and safe as possible. I personally have treated people from as young as a couple hours old to patients that are over 100. Literally. And even though, you know, those babies that are just born don't often need to be adjusted, it's a good idea to get them checked, because the things that start right from birth sometimes are affecting patients as young as 12 or 13 years old, or as old as 30 or 40 when they come in and their spines actually look like they're much older. So getting adjusted young, when they're young, is very important. You know, a lot of times when children are toddling, they take a lot of falls and slips. As they start to get older and they start riding their bikes, maybe they run their bike into a tree, and so their parents rush them to the emergency room, which they should, and the emergency room checks them for fractures and dislocations and things of that nature, which they should. But what they don't look at is they don't look at the small changes that occur in the spine due to that trauma. Those joints stop working the way they should. They end up with arthritis, and that's how we end up seeing people in their 20s and 30s with spines that look much older. The next myth is that chiropractors aren't real doctors. Generally speaking, chiropractors have to complete 4 years of pre-med undergraduate education, learning about various scientific fields, and then they have to attend 4 to 5 years in an accredited chiropractic school. And during these years, students must complete a minimum of 4,200 hours of coursework, followed by the same medical licensing exams as MDs and DOs have to take. And a lot of people really don't understand that. When it comes to our licensing exams, the first 2 parts of national board exams are exactly the same for medical doctors and chiropractors. It's not until we get into parts 3 and 4, which distinguish our areas of expertise or our fields of study, that those tests start becoming different. The next myth is that once you start going, you have to keep going. Everyone is afraid of making commitments, especially financial ones, and no one wants to hear that once they start seeing a chiropractor, they have to go for the rest of their lives. A chiropractor should come up with a plan that includes the number of treatments needed to complete treatment for that problem, and once care is completed, if you choose conservative maintenance care in the same way you would choose to eat healthy foods if you lost weight, or exercise if you start working out, the choice to continue going is completely up to you. Many people realize how much more comfortable they are when they get adjusted regularly, how much more vigorously they're able to lead their lives. And so they may choose to come in on some sort of a treatment schedule, but whether you need to or not is completely a personal choice. The next myth is that adjustments hurt. When someone's experiencing back pain, the last thing you want to experience is worsened pain. Correct chiropractic adjusting shouldn't be painful. Though there might be some discomfort, this is more to do with the presenting injury than the adjustment itself. So generally, patients feel relieved and more comfortable after an adjustment. The next myth is that chiropractors are only helpful for back pain. Chiropractors do help with back pain, but this is only one of the many conditions that we treat. There are conditions that chiropractic treats, such as headaches, fibromyalgia, whiplash, carpal tunnel, and other peripheral joint problems. Not only that, but a good chiropractor will use a variety of approaches to help most conditions. Next is that adjustments grind and crack your bones. There's a famous comedian that used to say that, well, I'm spacing off his name right at the moment. Eddie Izzard. He used to say, chiropractors crack your bones. You've got a headache, they're going to crack your bones. If you got malaria, they're going to crack your bones. Well, that's really not true. This falsehood stems from the sounds that occur during an adjustment. And these popping sounds actually aren't your bones popping or grinding. It's actually a release of gas bubbles between the joints. Just like when you pop your knuckles, you hear the same exact kind of sound. That noise is from the pressure in the joint changing. It's not from your bones being damaged. Next is that cracking your own back is the same thing. And that's probably one of the most frustrating things that we hear as chiropractors, considering the above information about the advanced training that chiropractors have to receive to be able to practice. This training enables chiropractors to have an understanding of the sensitive nature of joints and how they function. Just because you hear noise when you crack your back at home doesn't mean that you've achieved the same results as a carefully orchestrated spinal adjustment in the chiropractor's office. Even chiropractors can adjust themselves. I see a chiropractor just like my patients do. And even though I jokingly say to my patients that the difference is that my chiropractor isn't as good as yours, but that's all jest aside. We can't adjust ourselves. We just can't get the same line of drive and the same biomechanical efficiency when we try to do it on ourselves. The next is that there's no proof that chiropractic works. Studies, this is totally a myth. Studies in recent years have shown the efficacy of chiropractic care. A study conducted by AV Med, which is the largest medical health maintenance organization in the southeastern U.S., examined the first 100 patients seeking help at the Silverman Chiropractic Center. Of the 100 patients, 80 had already been treated medically without results, and after receiving chiropractic adjustments, 86% had their conditions corrected. None needed surgery, and none felt worse. Though this is just one study, there are actually many others that show similar effectiveness, and it just really effectively debunks the myth that there's no proof that it works. So, in conclusion, if you or someone you know were reluctant to visit the chiropractor because you believed one of these myths to be true, hopefully you can now see that the work that chiropractors do is effective and helpful for people with a range of conditions. So to schedule an appointment in our office, just call us. We're at Performance Chiropractic in Olathe, Kansas at 913-782-5000. You can find us on the website at www.myperformancechiropractic.com. We're also on Facebook, LinkedIn, Google+, and Twitter. On Facebook in particular, you can find us at Performance Chiropractic-Olathe. We hope to see you there. If you have any questions, feel free to email us at performance_chiropractic@yahoo.com. You can also contact us through our website. There's a way to do that. Send us a message on Facebook or just give us a call. I'd be glad to see if there's anything that we can do to help you and schedule you to come in to be able to talk to the doctor. Have a great day, everybody. I'm glad you listened in. Hopefully you learned a little something, and we'll see you soon.